Welcome to PIB News Podcast for Civil Services. Measures to tackle black marketing of blood. It is primarily the responsibility of the state and union territory government to take concrete steps to prevent illegal activities taking place in blood banks and during blood transfusion. Government has made registration of blood banks mandatory as per the provisions of Drugs and Cosmetic Act and rules thereunder. Further, Government has notified Drugs and Cosmetics Second Amendment Rules 2020 which pertain to functioning of blood banks and centers, blood processing and related matters. The implementation and monitoring of aforesaid Act and rules is within the ambit of the states and union territories. A letter has been issued to states and union territories to take concrete steps for prevention of such illegal activities. Further, the E-Rakt Kosh web portal of Government of India provides the interface for blood banks data management and integration. For this, all blood banks have been advised to register on E-Rakt Kosh web portal. It is also the primary responsibility of the state and union territory government to ensure the establishment of blood banks as per their need. The policy of the government advocates for a hub and spoke approach towards transfusion services, wherein blood is collected and processed in the hubs, which are high-volume blood banks, and distributed through spokes, which are smaller blood banks and blood storage centers. The requirement of blood banks depends upon the health infrastructure of the area. However, blood storage centers can be established in remote areas to meet the emergency requirement of blood, which may be attached to blood banks. Support is provided to states and union territories to strengthen their healthcare system, including strengthening existing blood banks and supporting new blood banks and blood storage units based on the proposals submitted by the states through National Health Mission. Government of India through blood transfusion services also supports 1131 blood banks in the public and charitable sector in respect of manpower, procurement of blood bags and testing kits, conducting voluntary blood donation camps and information education communication activities, etc. In addition, mobile vans for blood collection and blood transfusion vans are provided to the states and union territories. Thanks for listening. Kindly like, subscribe and share.